Weight loss injections. Are things like Wegovy, Mounjaro, Ozempic actually dangerous long term? A lot of people ask me this. So, you might have heard about things like pancreatitis, thyroid cancer, stomach problems. But actually, the truth is, the real risks may not be as worrying as we first thought. Okay, so let's start with pancreatitis. This was a big concern early on, but the big studies have shown that there's actually not an increased risk among people taking these medications compared to baseline. And in fact, for those people with diabetes, the risk might actually be lower. Okay, thyroid cancer. The initial concern came from animal studies, but there's been no good human data so far showing a clear increase. So just something to keep our eye on, but probably not yet a proven danger. And actually, most side effects people notice are the stomach ones. So loads of people get nausea, constipation, diarrhea, feeling sick. Well, and some people it's so bad they have to just stop. It's super common, but for most people that will settle. For a very small amount of people, they might have long-term gut problems. What you will be hearing about is hair loss and muscle loss. And this is true. But it's true of any kind of sudden weight loss, and your body's just adapting to the calorie deficit. You've just got to make sure you're getting adequate nutrition, especially protein, and you're doing resistance training. It is so important. You've got to do that. But we can't ignore the other side of the scale because carrying too much body fat increases your risk of heart attack, stroke, type 2 diabetes, and even some cancers. So it's always about balancing the risk for each individual. And there might be some positives as well as the weight loss. Early studies suggest these medicines can help with addictive behaviours. So people end up being able to drink less alcohol if they want to cut down, smoking, even gambling. And it can be helpful for your heart, and it's looking really good for liver health. So if you've got fatty liver disease, they can be really good. So when you look at the big picture, for most people struggling with obesity, the benefits outweigh the risks, as long as they're used with proper support, medical support, and not just used as a quick fix. Also, they may be expensive if you're having to pay for them. What do you reckon? Would you use these injections? Do you use them? Are you worried about the long-term use? I'd like to know what you think. Let me know.